Hi, I am a care coordinator at Iredell Memorial Hospital. Today I would like to discuss with you the role of a care coordinator, in-home services you can anticipate, and medical equipment you will need for a successful recovery. Our orthopedic surgeons anticipate all hip and knee patients to discharge home within 24 to 72 hours of surgery. The ideal discharge plan for all of our hip and knee replacement patients is to return home with either outpatient rehab services or in-home therapy, also known as home health, and a two-wheeled rolling walker. On the day of surgery, after you have settled into your hospital room, a case management team member will perform a discharge planning assessment. To complete this assessment, we will meet with you at your bedside, verify your contact information, home address, and insurance provider. We will discuss your current home environment, current services you may be receiving, and any durable medical equipment you possess or have access to. You will be given a discharge planning booklet. This booklet contains valuable information regarding the discharge planning process. We will discuss which type of therapy will be appropriate for you. If home health is determined to be appropriate, you will be provided with a list of home health care agencies and their star ratings. You will be asked to review this information and let us know your agency preference for your in-home care. We will then obtain orders from your surgeon and arrange the appropriate services for you. The orders from the orthopedist will be sent to the agency of your choice. The agency will review the doctor's orders, verify your insurance information, and their ability to staff the services you need. Once the agency has confirmed they can accept you as a patient, the agency's information will be added to your discharge paperwork. For patients who will be going to outpatient rehab, your outpatient appointment will be noted on your discharge instructions. If you are discharged on a weekend, the outpatient rehab facility will call you on Monday morning to schedule your appointment. For patients who will be receiving home health, the home health care agency will be notified when you are discharged, and your discharge information will be sent to the agency. The agency will contact you within 24 to 48 hours to arrange the first in-home visit. If you do not receive a call from the agency, or if you have any questions, please refer to your discharge instructions for the agency's contact information. Another important aspect of the discharge planning process is arranging durable medical equipment. All of our hip and knee replacement patients will need a front-wheeled walker. If you do not have access to or possess a front-wheeled walker, one will be ordered for you and delivered to your hospital room. Please note, a four-wheeled walker with seats are not recommended. A successful recovery when you arrive home is our priority. While not common, there are risks for complications that can occur following a surgical procedure. Let's review what complications you should be aware of, their signs and symptoms, and what you should do if any of these complications occur. If you experience pain in your lower leg and the skin in the painful area is red or has a red streaked appearance, you may have a blood clot, also referred to as a deep vein thrombosis. Please note this can occur in either leg, not just on the side where you had surgery. If this occurs, you do not need to call 911, but you should come to the emergency room to be evaluated. If you have sudden increased shortness of breath or sudden onset of chest pain along with these symptoms, you should call 911 immediately, as you may have a more serious condition known as a pulmonary embolus. Pneumonia, a respiratory illness, causes shortness of breath, a productive cough, and a fever. If you develop any of these symptoms, please call your primary care provider and follow their instructions. They may request that you come to their office for an appointment. A fever combined with white, yellow, or green drainage coming from the incision site, as well as red and irritated skin in the same area, could be a sign of infection. Please call your orthopedist if you notice these symptoms and follow their instructions. We look forward to assisting you with your discharge planning needs. Thank you for choosing Iredell Memorial Hospital.